The lymphatic system plays an important part in the general overall health and well-being of the human body. It does this by removing toxins and waste from the tissues and depositing it into the cardiovascular system for removal. When there is a disruption to the system, it can cause a condition known as lymphedema. Lymphedema is clinically defined as a swelling of an upper or lower body extremity due to this disruption. Primary lymphedema is hereditary and uncommon. It's also due to hypoplasia. Secondary lymphedema is much more common and likely what we'll see in clinical practice. The causes of secondary lymphedema are everything from tumors to extensive burns that go deep into the tissue, to scar tissue, radiation therapy, or to surgery that includes removal of lymph nodes. Acute lymphedema is usually post-operative or post-trauma, usually resolved within a couple weeks. Subacute lymphedema, on the other hand, is persistent, does not resolve or reduce with traditional therapy techniques, which we'll discuss later in this presentation, and usually presents with a thick, spongy surface or appearance to the skin that does not rebound from indentation. Chronic lymphedema lasts longer than 3 months. Lymphedema also can be broken down into stages. The early stages of lymphedema have pitting and usually return to normal by morning. If you go to bed, say, swollen ankles, come morning, you'll have a nice normal ankle. The middle stages, or second stage, is non-pitting. It's chronic inflammation that leads to early stages of soft tissue fibrosis. The later stages of lymphedema are irreversible due to the soft tissue fibrosis.
Medical interventions will focus on the two primary issues with lymphedema, which are swelling and the collection of fluids. MRIs and CT scans give practitioners an inside look at what is going on. However, according to the Cancer Center Treatments of America this year, the most effective test is a lymphography. Lymphography is a radiograph which uses specialized dye to highlight the lymph nodes. You can see they come up nice and clear over here too. They show up just like bones on a standardized x-ray, but they come up a little bit brighter. To reduce swelling, blocked lymph must drain. Manual lymph drainage and gentle massage are used. Also, we know that there's a direct link between the cardiovascular system and the lymph system. So moderate exercise, light exercise helps the lymph to move. Compression bandages and garments, as well as elevation, will both help to decrease the inflammation as well as encourage the lymph to move down from the affected limb and get back into the trunk. Treatment team will need to look out for infections, clots, and skin breakdowns. Worst case scenario will require surgery or referral to a specialized clinic. As with all medical conditions, early detection is the key. Client factors are broken down into 3 different parts: spirit, beliefs, values, beliefs, and spirituality, body structures, and body functions. Values, beliefs, and spirituality affect occupations by the value of appearance, especially with the need to fit in, the need to be independent, the loss of connection with the client's family, with their faith, with their significant other, and also with their self. Body structures are anatomical parts of the body that support body functions, so they go hand in hand. They would include hair loss, weight loss, swelling, skin discomfort, or tightness, breakdown of skin like wounds or ulcers, and changes of skin like hyperkeratosis, which is hardening of the skin, which you can see in this picture, on the heel and the ball of the foot. Hyperpigmentation, which is darkening of the skin, which you can see in this picture. And papillomas, which are wart-like structures on the outside of the skin. And also fungal infections. Body functions are psychological functions of body systems. In the affected arm, you would feel pins and needles, weakness,
heaviness, aching pain, decreased flexibility and range of motion because of edema, loss of sensations, including touch, temperature, pain. In the body, it would include recurring infections, difficulty sleeping, and decreased range of motion. Performance skills are observable elements of action that have a functional purpose. They include motor skills, process skills, and interaction skills. Motor skills are observed during occupation as a client interacts with and moves objects and theirself around. They usually include difficulty with gripping, grasping, and holding small diameter objects. Decreased flexibility and range of motion, and increased edema during warm weather, before menstruation, and after a long time of having the limb in a dependent position. Process skills are observed as a client interacts with problems during occupations. A client may be limited in the ability to understand and follow the instructions for limp management due to pain medications. And social interaction skills are observed during a stream of social exchange. Social interaction skills are usually decreased due to frustration, anger, depression, discomfort, and embarrassment or fatigue. Difficulty with personal relationships. Sometimes they have difficulty with personal relationships due to a loss of sexual desire.
One of the effects that lymphedema has is on the psychosocial well-being of not only the person that has lymphedema, but also on how the community views him or her out in the public. Susie wrote on the Lymphatic Education and Research Network website that she cried the first time that she had an outbreak of lymphedema. How terrified for the future she was, especially since she was a mother with a 2-year-old child. She went on to state that putting on the prescribed sleeve reduced her to feeling like a patient again, and that it was a reminder that she was and forever would be different. However, worse was yet to come in her first public outing when she noticed a little girl staring at her oddly. And to add insult to injury, fluid began to build up between the top of her sleeve and her shoulder, causing further disfigurement. With that came a throbbing pain that was constant and would not go away. The fluid buildup put pressure on the nerves, causing numbness and weakness in her hand. Sue did go on and find other types of compression garments that helped her with her situation, and she learned a lot by finding a website like Lymphatic Education and Research Network. She now hopes that through advocacy, women will be armed with knowledge. Knowledge empowers women to take charge of their situation, and early intervention is the best chance of living a full life, to quote her.
Psychosocial intervention for CODAs and OTs primarily comes from the bolster of sense of self-worth. And we also know that patient involvement is the single most important factor to lymphedema management. Role-playing is the one we found most common for this treatment, to give the client a chance to answer awkward questions that might come up, or how to respond to reactions such as Sue had experienced in what you just heard. It increases their confidence by allowing them to be prepared for what they're going to come up against. Group support is another huge helper. Family, friends, from a multidisciplinary medical team, all the support they can get is necessary. Cosmetic groups have been formed to help lymphedema and carcinoma patients to see the beauty. It emphasizes the beauty of who they are while kind of pushing away those feelings of ugliness that they experience. But as CODAs, it is our job to help them focus on the solutions to the problem and not the problem itself. Rehabilitative involvement is so critical, and it takes commitment, reminding them of that. but a really great tool that we can point all of our clients in the direction of is online communities. The one that we got Sue's story from was lymphedicnetwork.org. But every sort of disability has a network of this sort, at least one. It gives them an opportunity to hear the stories of others, to see how they coped, to see what might work for them, and to get strategies, ask questions. But it also helps them to see how others have come out of it and gives them hope for if they continue on in this direction. It will come to an end. It will get better. It is hard work fighting our own minds, but the effort changes the results of healing completely. Carol Nizek, a 2-time breast cancer survivor, did just that. In Keeping Your Self-Esteem After a Mastectomy, in the article, she said, "I coped pretty well with the loss of my right breast. To keep myself sane, I thought of the bright side of the picture. I was going to get a perky breast, what I always wanted. The loss of my breast has not affected my self-image. Actually, it has made it better." As we discuss effects of lymphedema on client occupation and explain OT intervention, Toni will demonstrate for us the difficulties of gripping and grasping. As you can see, she's placed a silicone glove over top of her winter glove to simulate a swollen hand. So we will show through this how occupational therapy uses specific tools and specialized tools in intervention.
For simplification purposes, from this point on, we will focus on lymphedema of the upper extremity. Effects on ADLs and IADLs would include difficulty buttoning or closing clasps, pulling zippers, gripping, eating utensils and cups, difficulty with washing hair and body due to limited range of motion, the inability to wipe when toileting, difficulty redressing, and inability to grip a hairbrush, toothbrush, or shaver for grooming.
All right. One of the challenges faced with someone with lymphedema in their ADLs is dressing. The general rule of thumb is to put your affected limb into your piece of clothing first, followed by your unaffected limb. This is due to a lack of range of motion in the affected limb. It also gives you the opportunity to use the unaffected limb to assist in the operation. Paige is going to demonstrate this by putting on her coat by herself. Again, the affected limb went into the coat first. Now she's able to reach back with her unaffected limb and get her sleeve on the other side. When it comes time to take her coat back off, she needs to reverse the process, taking the unaffected limb out first, followed by the affected limb. Again, that's due to a lack of range of motion, lack of function that comes from the inflammation that comes with the edema. And sometimes it's just a safety net measure. Okay.
Ergonomic slip-ons like this can help with holding when you have a large swollen hand. It's universal, as we'll show you in a moment, but you can put forks, knives, pencils, pens in there to help you out. Cups, such as spout cups, are lidded. They also have a wider circumference and taller, so they're easier to pick up and they do not spill, much like a sippy cup. As Toni is now going to demonstrate, there's assistance required for dressing. Buttoning buttons, as Paige had said, is a difficulty. She's going to use a
Homemade button hook.
Homemade button hook. Toileting, bathing, and grooming will also require assistance. This is the homemade button assister. As you can see, there is a bent paper clip here. Toni has lovely duct tape around a napkin on the handle, and then she has this little rubber band so that she can keep it on her wrist and not lose it. The client will be educated in home exercise programs as well as self-massage. This video shows 2 different kinds.
Okay, I'm going to show you how I made the handy dandy button hook that you saw previously. I started out with taking a simple paper clip, unfolded it. As you can see the end of the paper clip here, I unfolded the other end, caught it on an ink pen, and just twisted until I had a hook shape. Then in our research today, and we will show a picture of what a button hook, commercially made button hook looks like. We found this design of button hook as well. So we decided to make a new one that had both the button hook zipper pull and a button hook on each end.
Upgrade.
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 All right, for the basis for our stability, we're going to use a simple knife. The first thing we're going to do is add the hooks to the knife. I have to admit that putting the hooks on these things would have been a lot easier if we had certain household tools like a wrench or needle nose pliers, wire cutters.
But necessity is the mother of invention. So here we are, using what we have.
Right. You're going to want to make sure that none of the edges are poking out that could potentially hurt your patient or client. Okay, got hook number 1 on. Now for hook number 2. One other thing I did, both in the original and in this one, was make sure to loop my tape through something like this that'll help hold it onto the center point, to what I'm using for the basis of my stabilizer. This part doesn't have to be like super perfect because we're going to be wrapping it and covering up stuff. Actually needs to come down a little farther.
That?
Mm-hmm. Like that.
See, it's down a little ways to add stability when we tape it. And so it's not quite as long.
Right. Yeah, it doesn't need to be 50 foot long.
Depends on what you're grabbing, Toni.
Right.
Yeah.
Okay. Again, this tape method right now, I use duct tape in the original, using masking tape now, is just to get the initial design started.
Yay.
All right, in the original and in this one, I used Kleenex to give a little cushion to it and to give it some more bulk. And going to use that again in this design. Find the best way to lay this out. I'm actually using 3 Kleenex in this one. I used 2 in the original.
This one's bigger.
This one is definitely longer and bigger. And just rolled. Just like so. It gives it a little bit bigger, a little more bulk. And in most cases, you're probably going to want it even bulkier than what I have it here. Okay. Again, a little tape. Just to hold things in place. Yeah, this definitely could be thicker. To make it a little easier to use.
Feels sturdy though.
Mm-hmm.
Yep, it's not going to come
Nice
apart.
and sturdy. Okay. Now, just for the aesthetic of it, we are using some red paper to kind of jazz things up. And again, you know, that's going to be how your client wants, what your client wants, how it looks. They make so many different kinds of duct tape out there right now that you could pretty much customize any piece of equipment you wanted to for your clients or your patients.
Sparkly glitter psychedelic.
Yes!
Woo!
That would be me. Purple unicorn rainbow glitters.
Yeah.
Camo for the hunting enthusiasts.
You want this stuff for that?
Yes.
Would you like some tape?
Yes, please. We're using plain Scotch tape for the outside because, let's face it, masking tape is kind of just blah and ugly.
Unless you get some really pretty stuff, which I don't think masking tape's really gone that far yet.
No.
Come on, masking tape. Catch up. All right.
Okay, and there you have it, your own homemade button hook.
Ta-da! Manual edema mobilization, or MEM, And massage techniques require specialized training, so do not attempt them unless you have a certification.
Effects for education and work would include challenges in lifting heavy items with the affected limb, writing, and performing occupations for a long time.
A workspace can be modified for elevation of the limb as needed. Also, again, we have this ergonomic attachment that Toni can use for writing. Writing on the back of my note card. Whereas without it, regular pencil is considerably more difficult. She cannot even wrap her fingers around it.
Oh, I can't.
The reacher again will be used to grab things on shelves above, as well as on shelves and drawers below to open things that she will not be able to grasp without it, like a pencil or a marker. Good job, Toni. Of course, all interventions will be dependent upon the type of workspace that is being used.
The effects for play and leisure are limited by the need to protect skin, modify tools, and not to lift heavy items.
OT recommendations would be skin protection, such as sunscreen when outside, wearing gloves for outdoor chores, and water shoes if a hobby is involved with water situations. For carrying, make more trips, make them lighter loads. The client will also have to modify tools for gripping, just as we have done here, and pacing is very important. Make sure that the client paces him or herself. As you can see here, Toni is engaging in one of her favorite leisure and play activities, which is bingo. As you watch her having difficulty picking up her chip and placing it down, whereas instead we have added a modification of a pop cap. It just, the height of the pop cap allows her to pick it up and move it around more easily.
The effects on rest and sleep will require adjustments for elevating the affected limb.
The client will be educated in the use of compression sleeves and garments, as well as proper bandaging techniques. We'll also educate on how to situate pillows, not only to elevate the limb during sleep, but also for maximum comfort, because it's just not comfortable to lay with one arm up. Timers also are recommended for reminders to sit and rest and to elevate the limb.
The effects of social participation include difficulty due to decreased mobility, discomfort over appearance, or fatigue and pain.
The job as a CODA will be to help the client overcome barriers, whether they are physical, mental, or emotional. Gradual reintegration into social situations will be necessary, as well as we recommend beginning with emotionally safe environments until the client feels less vulnerable.
There are multiple challenges to everyday activities with lymphedema, but even more solutions.
As CODAs, we have the privilege of restoring independence through useful solutions.
Be creative. Bye.
One more slide.
Okay, take two.
Are anatomical parts, body structure.
By taking toxins, oh, let's start this over.
Things will be put on your coat.
Oh.
I'm glad we can stop and go. Okay.
We're actually recording.
Things you can't do with lymphedema. Johnny Bravo. Ooh,
Shopping cart.
shopping cart. Reach and grab and reach. Reach and grab and reach. Gotta make sure you get that funky chicken.